Welcome to Bespoke Diaries. Today's article is on Turning Obstacles into Success by Dr. Faith Mumba, Medical Doctor, Zambia. Coming from a low-income country, which is burdened by HIV/AIDS, has resulted in Dr. Faith developing an interest in the medical field and research. She lost her father to HIV/AIDS, and grew up seeing him deteriorate from the disease. Being the oldest in her family, Faith had to take care of her sick father as her mother would go and look for greener pasture. All this had an impact on her social, emotional, psychological, and physical well-being. And because of what Faith endured, she developed a keen interest in learning more about the disease, and through that, she developed a passion to take care of the sick. From that moment, Faith knew she wanted to become a doctor. After the death of her father, Faith's mother became sick, and this also affected her even more. Having to go to school and going back home to take care of her sick mother. But all this did not stop her from achieving her goals. Faith worked even harder, and years later she managed to get into one of the biggest universities in Zambia to study medicine. Even though all this built her character, for most young people out there it is not the case. Some fall prey to depression, drug addiction, and so many more psychological disorders. Faith graduated with a bachelor's degree in human biology and a Bachelor of Medicine, a Bachelor of Surgery, MBCHB, from the University of Zambia. During her clinical years, Faith had gotten more exposure to the medical world and all the different specialties it has to offer. From that, she developed an interest in working in pediatrics, primarily with children affected with HIV/AIDS, and other infectious diseases. In line with this, Faith's main aim is to specialize in pediatrics. She believes the well-being and development of a child are influenced by so many factors: biological, environmental, social, cultural and behavioral factors. HIV/AIDS has a very big impact on the physical, mental and social well-being of a person. Children infected at birth grow into adolescents who have to deal with their HIV status. These adolescents, if not properly counseled, can tip into depression, drug addiction, can become suicidal with the high levels of stigmatization in Faith's country. And because of these burdens her country is facing, she would love to gain more insights from leading experts in developmental psychopathology. As the field of child psychology continues to evolve, Faith believes it is relevant for her to understand and know how to treat psychological conditions. She believes good mental health helps one live their life to the fullest and is essential in successfully managing HIV/AIDS. Aside from studying medicine, Faith is an advocate and advisor for the Zambian network of young people living and affected with HIV. This is an organization that was established in 2016, and aims at improving the quality of life of young people living with HIV, and those affected by pursuing support, communication, and representation on issues affecting them using community structure and youth-friendly spaces. One of the many other things they do is psychosocial support and capacity building. Through an interaction with these youths, Faith has learned that there is a lot of work where psychosocial support is concerned. These youths feel neglected and most of them tend to be depressed. In addition to her experience, she is interested in using research to help her give back to the community. Faith was a member of the Young Emerging Scientists, a non-profit organization that was established in 2018. This organization creates a renowned career and research hub for the young scientists that are cardinal in underpinning their career progression and contribution to society. Their mission is to provide an exception mentorship system for state-of-the-art research to the budding scientists. Through this platform, Faith had come to learn the importance of research in every aspect of life. Research in health provides important information with regards to the disease trends, and risk factors, outcomes of treatment or public health interventions, and healthcare costs. During her university years, Faith was actively involved in student affairs. She once served as the publicity secretary for the Student Union, and later served as the vice president for the University of Zambia Medical Association. During her tenure of office, she capitalized on sensitizing the community on the various diseases affecting the nation, and how to prevent them. She has also served as the student chapter president of the Medical Women Association of Zambia. Faith recently worked with mobile medical services, and during this period she developed clinical protocols and standard operating procedures for the clinic and helped come up with quality management system. She has led and worked together with a multidisciplinary team of clinicians to take care of patients with chronic illnesses at the nursing home. During this time Faith built up her clinical skills and profile, both nationally and internationally. She also delivered substantial contributions in leadership, teaching and management. As a female doctor, Faith has played a significant role in advocating for more females in the STEM field, and has received recognition by magazines, Africa Arise, Africa Power Women, STEM Zambia newsletter, and platforms that recognize females in the field of STEM. Through this many females have been reached out to and encouraged to join STEM. Faith is passionate and committed to giving back to her community using the knowledge, skills and experience gathered over the course of life. She has strong values built on helping others, as well as acts of generosity and kindness. Thank you for your time. Don't forget to like, subscribe and share. Do leave your thoughts in the comments section below. For similar type of article please reach us at contact@thebespokediaries.com, or you can visit our website www.thebespokediaries.com.